have, just from aging, just like we all may need reading glasses at some point, we're going to have some kind of, I would say, natural hearing loss as we just get older. But at what point do you say, okay, you know what, now's the time to maybe take that next step?
Typically, what I find is people come in, it's mostly family members that notice first. You know, the television's been cranked up a little bit more.
Right.
You start having trouble in noisier environments. That's when it's time to come in, and then we can really see where our thresholds are at, where our hearing levels are at, and if a hearing aid is appropriate at that time.
Okay. I've often heard that it's usually, like you said, the family members who notice it first, because they're always looking at their, you know, their grandfather or something like that, and going, "Didn't you just hear what I said?" And of course, they're usually like, "Yeah, I did."
We compensate.
Yeah.
I mean, we turn up the volume, we start leaning in a little more, we kind of fill in the gaps, and then we shouldn't have to do that. You need to get a hearing test.
Yeah,
Yeah.
exactly. How often do you recommend just a general hearing test for folks? And is it different ages?
About
more
once a
frequently?
year. We like
Okay.
to monitor it. If anything, if you're feeling like you're having trouble, get a baseline so we can see where we're at, and then we can monitor you year after year to just check that nothing's changed, that everything's stable. That's what
Okay.
we want.